Hi, my name is Josh DeSipio. I work with Cooper Digestive Health Institute and MD Anderson Cooper. Today I wanted to talk to you a little bit about acid reflux, and in particular the medications that we use for treatment of acid reflux. There's several different class of medications. A lot of them you can buy over the counter. So antacids, stuff like Tums and Rolaids, which I won't be talking about in any depth today. Additionally, there's a whole class of medications called the H2 blockers like Zantac and ranitidine and Axid. In particular, I wanted to focus on the third class of medications that we use very consistently, particularly as gastroenterologists, the proton pump inhibitors. These are the strongest medications that we use for the treatment of acid, and they really block the creation of acid at the source in the stomach. We potentially have patients on these medications for a long period of time, sometimes lifetime, sometimes high dose at twice a day. And some of the medications you may have heard about in this class are things like Prilosec, Prevacid, Protonix, Nexium, Dexilant. There's a whole host of medications. There have been some recent reports about these medications and potential complications of long-term treatments. And in particular, patients that are on these long-term are more likely, although slightly more likely, to develop malabsorption of calcium and iron and magnesium and some microelements, because we do need acid to absorb these substances in our body. In addition, there were some reports that patients that took long-term proton pump inhibitors were more likely to develop dementia and potentially renal insufficiencies. So a comment on these. The studies that were involved, particularly in the last two complications, dementia and renal insufficiency, were not studies that were designed to look at at a causative factor, meaning that the acid suppression medication actually translated to these findings. And they were poorly done and not intended for that purpose. I think that the bottom line to remember as a patient when you're taking these medications, and something that our national guidelines recommend, is if you have symptoms that are consistent with gastroesophageal reflux disease, and in particular you have inflammation, that suppression of the acid heals that area, and prevention of long-term inflammation in the esophagus prevents complications such as Barrett's esophagus and esophageal cancer. So hopefully that helps in discerning a potentially complicated market in what you see in advertisements and read in the newspaper. If you have any questions, feel free to contact us at 1-800-8-COOPER or online at cooperhealth.org. Thank you very much.